I have just enacted an executive order to activate the National Guard and move the Guard to a higher state of readiness in order to carry out any necessary functions and critical areas of need in the coming weeks.
We have the structure in place that we can stand up and work with the Maryland Department of Health.
No entity anywhere in state government, federal government is better prepared to respond to something like this than the National Guard. I'm proud that Governor Hogan has come to rely on the Maryland National Guard in the way that he does.
And so our primary function is to work with our resource managers at the Maryland Emergency Management Agency and support things such as food distribution. We were supporting the logistics of testing sites throughout the state.
We knew immediately that we were going to be involved in the mission support group specifically. We have the Force Support Squadron, who is a main role in our JRSOI. And we gave them briefings and then we checked out their medical records.
So another important mission that we had was the Strategic National Stockpile, and this is something that's ran by FEMA in partnership with all the states, in our case, Maryland Department of Health.
We started with about 10 or 12 guardsmen that went to support, and they were offloading pallets. Really, the distribution was where we would normally stop, but we ended up being part of the delivery as well.
One of the important responses that the governor and his team identified was to create hundreds more ICU beds and facilities. They delivered in just a few days this entire hospital set. A couple weeks after that, they were up and running and receiving patients. We helped the Maryland Department of Education distribute the school lunches at the various sites. So those are the missions that they enjoyed the most.
When we deploy, when we do anything like that, we're looking at humanitarian missions a lot of times, and that's always a feel-good mission. And there were so many times that our guys just wanted to be able to get out there and do the food distribution or go down to the warehouse and make a difference there.
I just think the community of Maryland should know that I believe that the National Guard's doing a great job at helping their actual community out.
Colonel Alley, Doc Alley, has the greatest expertise in the entire state. We set up these medical support teams to work with the Maryland Department of Health and assess every single nursing home around the state.
I had a couple of roles. One is the state surgeon, who started out here running the medical detachment, as well as being appointed by the governor, Special Safety and Compliance Officer for the state, looking at ways to protect the nursing homes during the COVID-19 crisis. Working with the community and combating this virus has been a privilege from the beginning. Working together, combating one problem, the major problem really. Death in the nursing homes is higher than many other of the communities that we serve. Of all the people that worked to curtail the spread of the disease through the nursing homes, the heroes, the real heroes, are the nursing home staffs. But working with them together has been outstanding, a real privilege.
The first place we set up was FedEx Field, and it was a great success. Patients on doctor's orders could drive through and get swabbed, and we take the swabs and send them off to the lab and then alert that person whether or not they've got COVID.
The neat thing about the National Guard is we are serving the communities we live in. We're serving our families, we are serving our neighbors. It actually matters.
We have some of the best cyber warriors in the entire Department of Defense right here in Maryland.
As a member of the 175th Cyber Operations Group, we're normally activated in support of federal or national contingencies. So it was a really great and rewarding experience to be activated for my first time in support of the state, to support Maryland and my fellow Marylanders during this crisis.
Our success as an organization, it comes from the quality of the soldier and the airman and the defense force that shows up every day. Being highly competent as a military professional and being some of the best Marylanders out there. And that's why the Maryland National Guard was successful in COVID-19. It was because of the quality of our soldiers, airmen, and defense force.
quality of the National Guard is that we're citizen soldiers, and a lot of us signed up because we want to help the citizens of our state and our communities.
We're the Maryland National Guard. We're always going to be there to meet the needs of the state and the nation. We're always ready, we're always there.